Alteplase is a thrombolytic drug which is used to dissolve clots which have already been formed in order to prevent life-threatening ischemia and tissue damage. They can be used in patients with deep vein thrombosis, pulmonary embolism, myocardial infarctions, and in patients with strokes. The mechanism of action is to convert plasminogen to plasmin, which dissolves the fibrin clot. For administration, for maximum effect of thrombolytics, they should be administered within 4 hours of clot formation. However, Alteplase can be effective on myocardial infarctions up to 12 hours after onset of symptoms, but its maximum effectiveness on thrombotic strokes is if it's used within 3 hours after the onset of symptoms. Adverse effects when giving Alteplase would be bleeding, so patients should be monitored for signs and symptoms of a bleed due to the drug not being able to differentiate between normal clots and life-threatening ones. For this reason, the drug is contraindicated in patients with internal bleeding, recent trauma or surgery, history of head injury, or in patients with uncontrolled hypertension. Nurses should be aware that lab levels of the PT, APTT, and fibrinogen will be increased in patients who have been on this drug. Patients should be educated that they should immediately report any spontaneous bruising, any nosebleeds, or hematomas to their nurse or healthcare provider. Patients should also be educated to avoid garlic, green tea, feverfew, fish oil, and ginger because they can cause increased bleeding. Patients should also avoid any drugs which may cause more bleeding or an increased bleeding risk, such as anticoagulants or NSAIDs. And as always, all drugs and herbal supplements should be reported to their healthcare provider before being placed on Alteplase.